This lecture is presented by Dr. Frank Shallenberger. Dr. Shallenberger has been trained in traditional medicine and is licensed as a medical doctor. He has also been trained in alternative and homeopathic medicine and is additionally licensed as a homeopathic medical doctor. Dr. Shallenberger graduated from the University of Maryland School of Medicine in 1973 and has been integrating the best of alternative medicine with the best of traditional medicine since 1980. He has authored several scientific and clinical papers, as well as 2 popular books which can be found at all of the major book outlets. He is also the editor of the Real Cures newsletter. Dr. Shallenberger is the medical director of the Nevada Center for Alternative and Anti-Aging Medicine in Carson City, Nevada. This lecture was recorded on August 7th, 2009.
Hi, I'm Dr. Frank Shallenberger. I'm a licensed physician, licensed MD in the state of Nevada. I'm licensed to practice conventional medicine, and that has always been my training. I've been practicing medicine for close on to 40 years now, and for the first 8 years of my medical training, I was an emergency room physician. But starting about 3 decades ago, I became very interested in alternative medicine, which basically means harnessing the body's own healing potential so that it heals itself. Keep in mind now, your body was made by the Creator to heal itself. We have healing systems, we have diagnostic systems. Dr. Albert Schweitzer called them the doctor within. But we have systems in our own bodies that are designed to heal our bodies. And so in alternative medicine, the question I ask is, when a patient has an illness, the question I ask is, why isn't the body healing it? To me, that's a much more important question than what exactly is the illness the patient has. And so today, I'm going to be talking about one of the really big issues of our time in medicine, and that is the treatment of stage 3 and stage 4 cancers. Keep that in mind. Stage 1 and stage 2 cancers are those kinds of cancers that have not spread in the body and can actually be completely surgically removed. So with a stage 1 or stage 2 cancer, it's quite possible that your surgeon can cure you by completely removing it. What I'm going to talk about is the stage 3 and the stage 4s, the kind of cancers that are spread enough so that they cannot be surgically removed. And the only treatment modality you have left from a conventional standpoint is either chemotherapy and or radiation. And so we're going to talk about stage 3 and stage 4 cancer treatment. And what I want you to know is that patients that have stage 3 or stage 4 cancer are in a real quandary these days. Because on the one hand, they have conventional medical therapy, the kind of medical therapy that I was initially trained in, that is endorsed by the AMA, it's endorsed by the pharmaceutical industry, and it's the kind that basically uses chemotherapy and radiation. And the quandary here is that it's been proven not to work. We know it doesn't work. And I'm going to show you some information like that in a couple of slides just to back up my position on that. So on the one hand, here we have these therapies that you know what you get, they're proven. The problem is they're proven not to work. You can buy a little time with them, but certainly there's no cures at stage 3 and stage 4s except for the occasional miracle cure. On the other hand, patients are faced with going into alternative therapies. And alternative therapies, even though they seem really attractive, and I'm going to talk to you about that today, they're basically unproven. So patients are in a quandary. I can go to something that's proven not to work, but at least to know what I get, or I can go into some other area where I have hope for an actual real cure, but these are unproven. And on the one hand, I can see conventionally licensed, well-trained physicians in higher institutions. And on the other hand, I expose myself to the very real possibility of getting in the hands of a charlatan or a quack physician or healthcare practitioner that is just all too happy to take your money and give you therapies that either they know don't work or give you therapies that they think might work, but certainly no science behind them. So what I've done in the last few years is I've tried to work the best of both worlds in here. So today I'm going to talk to you about a treatment, what I call comprehensive treatment for cancer that is going to combine the kind of the best of the chemotherapy world with the best of the alternative world. And I think that we can get some really outstanding results. We have certainly seen some absolutely outstanding results in patients who have been told by their conventional oncologist that they only have months to live, but who in fact can get into a complete remission using this particular kind of approach. So that's what we're looking at today. First of all, let's just start talking a little bit about chemotherapy. Let's look at some strong facts about chemotherapy. Okay, first of all, I think everybody knows chemotherapy is harsh. It will cause you to be sick. It will cause your hair to fall out. Some cases, chemotherapy will cause you to be weak, to lose weight. In fact, chemotherapy is so harsh that can actually cause cancer. One of the side effects of chemotherapy that's listed on the brochure that you get with the chemotherapy product is the fact that it is a cancer-causing drug. So these are dangerous drugs, and they're very harsh when given to your body, and patients undergoing chemotherapy often suffer considerably. Second thing about chemotherapy is, and it's related to kind of this harsh thing, but the second thing about it is dangerous. And that is, practitioners need to be very careful. Chemotherapy can knock out your immune system in a heartbeat. It can be toxic to your heart. It can be toxic to your liver and to your kidneys. And so not only do you have some of the harsh side effects with chemotherapy, but you have the very real danger that patients can be killed by chemotherapy. And in fact, there was a recent publication, one of the British medical journals, that indicated that many patients who treated for stage 3 and stage 4 disease, at least in Great Britain with chemotherapy, are actually knocked off by the treatment and not really helped by it at all, because it is a dangerous by nature treatment. The third problem with chemotherapy is that it's one-dimensional. And I'll expand upon that concept here in this lecture. But I'll hope to convince you that treating cancer is not simply about killing the cancer. That there are other aspects to look at, namely the strength and vitality of the patient that has the cancer and the cause of the cancer. If you don't eliminate the cause of a disease, I more or less guarantee you it will come back. If you don't strengthen the patient's immune system, strengthen the patient's overall ability to resist disease, there's a good likelihood the disease will either not be cured or will come back. Chemotherapy ignores both of these principles and simply goes for killing cancer. And so it's one-dimensional. It's not comprehensive enough to get the best possible result. Of course, chemotherapy does not work with the body. In fact, it works against the body. So it's not like you're going to put this chemotherapy drug into a patient and it's going to activate the immune system, or it's going to activate detoxifying processes, or it's going to somehow activate the natural ability of the patient's body to kill cancer. In fact, it's going to do just the opposite. It not only doesn't help or work with the patient's body, it actually will antagonize the way the patient's body works. Instead of helping the immune system work, it actually makes the immune system work worse. Instead of helping the patient to detoxify, it actually makes the patient more toxic. Instead of eliminating the causes of the cancer, it adds in one more cause. So this is yet another problem with it. It just doesn't work with the body. And finally, the last thing, it doesn't work. And so we're going to look at that in just a second, and I'm going to show you that it doesn't work. But so that you have an idea of why it doesn't work, just look at all these things. When you look at those bullet points there, you've got to sort of wonder why it ever works in the first place. Now we know, probably you've heard stories, and we know that there are some people, and I have seen them myself, who have gone into long-term remissions on stage 3 and stage 4 with conventional chemotherapy. We know this can happen. It's just a statistical rarity, that's all. So let's look at this next slide here. This slide, by the way, was taken from the website of the National Cancer Society website. This is a website that is oriented and designed around conventional oncology. So you can get this slide from their very own website. And it's a very telling slide. Let's just take a peek at it. Over here on the right side, what we're looking at is change in U.S. death rates by cause, comparing 1950 to the year 2005. And we're looking at rates per 100,000 people. So in 1950, for example, from heart disease, there were 586 people per every 100,000 people that died of heart disease. In 2005, however, that had decreased very significantly. That decreased almost 60%. Large drop in heart attack and deaths from heart diseases due to the effective treatments that conventional medicine has come up with. When we look at strokes, right down here, we see an even better improvement from 180 all the way down to 46. So almost 75% decrease in the death rate due to the therapies that are now being used for strokes. These are remarkable improvements from 1950 to 2000 in heart disease and strokes. If we look over here at influenza and pneumonia, the death rate from influenza and pneumonia has decreased by 50% since 1950. So again, showing you that we have conventional medicine has developed remarkably good therapies to decrease the death rate from influenza and from all kinds of pneumonia. But look at the last column here. This is cancer. The death rate from cancer has essentially not changed at all from 1950 to 2005. It's the same. Now here's the point I want to make to you. In 1950, chemotherapy was around, but it was hardly ever used. In 2005, chemotherapy is used all the time. So go figure it out. What this slide is basically telling you is that chemotherapy has not made one dent whatsoever in the death rate from cancer. You can extrapolate that and say, yes, it doesn't work. Patients lived just as long without chemotherapy in 1950 as they live now with chemotherapy. So it doesn't work. You'll notice there's a slight decrease in here, ever so slight, and that is due to the fact that there are several fairly rare cancers that conventional chemotherapy does work really well with. But by far and large, the cancers that you're going to see across the board, lung cancer, brain cancer, stomach cancer, all of that, chemotherapy is just a complete failure with. So let's be honest about it. And let's look at that and say, what else can we do? Instead of trying to find more and better chemotherapy drugs, maybe try a different approach, an integrative type of approach. But let's ask the question, given that it doesn't work, why doesn't it work? Well, I've already given you a little bit of an answer as to why it doesn't work. But we're going to go into some greater depths. I want you to understand this concept of occult or latent cancers and immune system control. So let me just take a little bit of a time here to talk to you about occult or latent cancers. There's a number of studies in the literature that look at this thing called autopsy studies. So what's a group of scientists will get together and say, you know what, I wonder how many people out there, say, have prostate cancer and don't know it. So let's go into the hospital and let's tell the hospital, listen, the next 50 men that die in here, we want their prostates. We're going to examine their prostates and see if they have prostate cancer. They do the same things with breast cancer. They do the same thing with brain cancer, any kind of cancer. And they publish these studies, and these are called autopsy studies. And what you get to do is you get to find out from an autopsy study how many people have cancers and they never really ever know about it. Well, the results from the autopsy studies are rather amazing. For example, autopsy studies prove conclusively that 100% of people over the age of 60 already have a cancer in their body, at least one cancer in their body. I'm not talking about a cancerous cell. I'm talking about literally a cancer growing in their body. So that if a pathologist were to get a hold of that piece of tissue where the cancer is, he'd look at it, he'd say, you've got cancer. So 100% of people over the age of 60 have cancer. It gets even better though. If you start looking at, there's one published autopsy study with women and breast cancer, where they looked at women aged 40. Most of these women had died from things like car accidents. So they autopsied all their breasts. They found out that in that group of women that they looked at, 25% of them had breast cancer in both breasts. 40% of them had breast cancer in at least one breast. So what is it? What do autopsy studies tell you? They tell you that if you live long enough to the age of 40 and certainly to the age of 60, you are going to have cancer. I'm a 63-year-old man. I automatically assume, no, I have cancer. At least one. I may have several cancers. Wouldn't be surprised. These are cancers that exist in my body, but they're below the level of detection. If I were to go get a colonoscopy, which I've had, but if I were to go get, say, a total PET scan or, say, a total body CT scan or something, they probably wouldn't find these cancers. These cancers are only found on autopsy because they're so small that they avoid the detection that you can find them on a CT scan. But they're there. So they're there, but you can't see them. So what scientists do is they refer to these cancers as occult or latent cancers. They're there, but you can't see them. Now here's what this shows. If 40% of women aged 40 already have breast cancer, and yet only 7% of women will get breast cancer in their entire lifetime, clearly 33% of those women have breast cancer their entire lives and never know about it. Why? Why doesn't it kill them? Why doesn't it advance? Why doesn't it grow? It doesn't grow because God gave us an immune system. And by an immune system, I don't mean to want you to think it's just like this one system. It's an entire collage of systems that controls and manages these cancers so that they're there, but they're not going to do anything. It's kind of like instead of killing the terrorist or killing the bad guy, you just throw him in solitary confinement. And he's not going to be able to do anything or hurt you. Your immune system is capable of keeping your cancer in solitary confinement. The concept here to understand is that to get a really good result with a stage 3 or stage 4 cancer, you have to have a good immune system. It's not enough to just go in there and use chemo and kill the cancer and shrink it down. You've then got to have an immune system that will come on board and take charge of that situation and keep the cancer down even after the chemo's gone. Then and only then can you get a long-term remission from a stage 3 or stage 4 cancer. And that's why chemo doesn't work. Because yes, it'll kill the cancer, but in the same process of killing the cancer, it kills the immune system, and when they take the chemo away, there's nothing left. There's less left there than there was in the first place. Figure it out. If you've got a cancer, if you've discovered you have a cancer, that automatically tells you your immune system has lost its ability to control it. So you're already, from the time you have been diagnosed, you know that your immune system isn't working all that great. So you take an immune system that's not working well enough, and then you poison the heck out of it, and then you're going to sit back and you're going to expect that the patient is going to go into a remission? It's impossible. You're hoping for the impossible. So what we need to do is come up with a therapy that's gentle enough to the immune system, but can at the same time kill the cancer. And that's what I think we can do. And we're going to talk about this concept in a second. But it's critical that you understand that your body already has cancer. And the reason that I and many of you watching me right now will never get cancer is not because we don't have cancer. It's because our immune system will control it to the point it never becomes clinically diagnosed. Okay, so that's the first reason chemo doesn't work. It poisons the immune system. It poisons our control systems. The second reason it doesn't work is it doesn't potentiate the control systems. So it doesn't improve those control systems, it actually worsens them. And the third reason is, again, I said this before, it's one-dimensional. It fails to address the critical issues. The critical issues in cancer are not just killing the cancer. The really critical issues are, why did you get it in the first place? What caused it? Some people get clinical cancer, some don't. Why? It's not just magic. It's not just chance. There's a reason why you got the cancer. Chemotherapy doesn't even address that question. They don't ask it. Your oncologist will not discuss why you got the cancer with you. And the second is your health status. And this is true for all diseases. So I don't care if I'm treating a patient with rheumatoid or I'm treating a patient with cancer, I'm treating a patient with chronic fatigue. It makes no difference. I want to know the cause because I have to eliminate the cause or they'll never get well. That's obvious. And secondly, I have to improve their overall health status. It's one thing to have a healthy, strapping person get over an injury or a disease. It's another thing to have a weakened, debilitated person getting over an injury or a disease. And that's too often the case. Most times when doctors see patients come in with diseases, the patient's already weakened and debilitated. And it's hard for that doctor to expect that patient's body to heal itself when it's in this deplorable shape. So we not only have to eliminate the cause, we also have to work on the patient's strength and vitality and improve their overall health. As I tell my patient, if you want to get well from this disease, you need to be the healthiest person on your block. And that's what we try to do. And we're going to talk a little bit about that next. So I think you're getting the idea now. Comprehensive cancer therapy means therapy that treats the cause. Why did you get the cancer in the first place? It eliminates the cause. That treats the person, gets the person to be the healthiest person on their block, strong, vibrant, so that their body can work well to resist and control the cancer. And third, kills the cancer. You've got to have all three. You can't just do these first two and expect that cancer to go miraculously away. It won't go away. So you need to do something to kill the cancer at the same time you're doing these others. And that is what a comprehensive approach to cancer employs. So let's talk about each one of these things. Let's first talk about treating the causes. How much time do we have?
40 minutes.
We've got 40 still? I think I'm going to because I got to keep it under an hour.
We're still running.
Okay, all right.
So, somebody's cut it.
No, I just want to make sure I keep it under an hour. Okay.
Yeah, you got about 39 minutes.
Okay.
Okay.
Okay, you ready?
Yeah, go on.
Okay. The first cause that we look at was defined by a Dr. Warburg in the 1930s. And Dr. Warburg actually won the Nobel Prize for Medicine for discovering this. And that is that one of the major, if not the major cause of cancer across the board is decreased oxidation. Oxidation refers to the way your cells can use oxygen in the process of metabolism. And the way your cells do that can cause cancer if they don't do that very efficiently. So I can pretty much guarantee any patient that comes in to see me with any stage 3 or stage 4 cancer, I have never yet met one who oxidizes efficiently. So Dr. Warburg was right. So that's certainly one of the causes we see. We can measure oxidation potential in the office, which we do all the time, and that needs to be corrected. So that's one cause. How do we do that? We can do what's called oxidative therapies. The one I prefer is ozone therapy. We can also use plain old oxidation therapy or oxygen therapies. These are simple therapies. They're safe, they're easy to do, and they actually make you feel good. And we can use oxidation intermediates, and that is certain nutrients that assist the oxidation process along. So that's one facet of a comprehensive approach to cancer that has to be done with each patient that we see with a stage 3 or stage 4 cancer. The next cause is liver dysfunction. 100% of patients with stage 3 and stage 4 cancer have dysfunction of their liver. I don't mean liver disease. I mean the liver doesn't work well. The liver needs to detoxify the body. The liver needs to control all the way sugar metabolism goes, all the way fat metabolism goes. The liver needs to control hormonal metabolism. The liver is the major organ, it's the biggest organ in the body, and it also is the most important organ in your body. And by definition, any patient with stage 3 or stage 4 cancer has a dysfunctional liver. It's not working well. So we need to focus on that. And we need to get that liver working absolutely perfect if there's any chance at all for developing a long-term remission. So how you do that? Well, we do a diet. This is where diet comes in. We use a special vegetarian diet, which is geared to improve the function of the liver and detoxify it. We use special vegetarian juice. We use regular juicing with fresh organic juice. And we use coffee enemas. Coffee enemas are enemas that were discovered by Dr. Max Gerson. And these enemas are not used to clean out the bowels like you usually think about an enema. The fact is that when you put anything into the rectum, it goes through the rectal veins, which goes a straight shot to the liver. So anything that you put in that rectum is going to go straight, absorbed right to that liver. So this coffee is like a straight shot to the liver. As soon as coffee gets in the liver, the caffeine in the coffee stimulates the liver to rather remarkably detoxify itself and dump all those toxins out in the form of bile. Almost instantly. It's absolutely amazing. So that with coffee enemas, it's a way to dramatically clean out the liver in a matter of 1 to 2 weeks. It's astounding how well these therapies work. So that's 2 causes. We're improving oxidation, we're cleaning out the liver. The third cause, of course, is toxicity. That is probably the ultimate major cause these days because we live in such a toxic environment. The foods we eat are loaded up with toxins. The medications doctors give you, the medications you buy over the counter are loaded with toxins. We breathe toxins. It's kind of hard to get away from it. In fact, it's impossible to get away from it, so don't even try. Limit your toxic exposure, but know that you're a toxic. Know that you've got lead in your body, you've got mercury in your body from dental fillings and from the fish and all the other environmental causes. You've got aluminum, you've got uranium, you've got titanium in your body. We've got so much junk in our bodies that it's really hard to expect them to heal from such a significant problem as stage 3 and stage 4 cancer. So toxicity is a big issue that needs to be addressed. What we do here in the clinic is we use infrared saunas. We use a special form of a foot bath, which tends to remove toxins out through the skin. We use oxycolonics, which is a version of colonic therapy, again, which we're cleaning out the bowel. You remove toxins through your bowels, right? So we use colonics can be used to clean toxins out through the bowels. They've been used, incidentally, in traditional medicine since the 1920s to detoxify patients from poisons. And then we use chelation therapy to remove lead and mercury or whatever might be in that patient's body. In other words, we need to clean the patient out. This is part of a comprehensive approach in treating the causes of the cancer in the first place. And then the last one here, of course, is the one that pretty much everybody knows about. Here you are walking around and you've got your latent or occultic cancers in your body, and your body's holding up to them really well, and everything's going along well, and then you face some trauma in your life. Could be emotional trauma. I just saw a patient the other day, and the reason that patient came down with the cancer is because before the cancer was diagnosed, for 2 years, had been undergoing 4 different lawsuits, and the stress was overwhelming. And that's what caused the cancer. So we need to look at any stress or emotional roots in this cancer, because stress will shut down your oxidation, stress will affect your liver, stress will shut down your immune system, and stress will overall remove those control abilities of your body to control cancer. So we need to definitely focus on eliminating any harmful belief systems that cause stress. And the good thing about stress is 100% of stress is created by us. Even though I'm getting sued, or there's a lawsuit, or there's an injury, or some other source of stress to my body, the emotional stress part of it is caused by how I think about that thing, not by that thing itself. And I won't go into depth on that, but you'll just have to take my word for it. So by looking at your belief systems, looking at your attitudes, I like to tell patients with cancer, listen, as soon as you were diagnosed with cancer, your life has to change. You cannot eat the same way you used to eat. You cannot exercise the same way you used to exercise, which usually means they didn't. You cannot have the same lifestyle habits, and you certainly cannot have the same overall beliefs and approach to your world and your relationships that you had before. You need to change, because whatever you were doing before is what caused this cancer, and we need to change the cause or there's no hope for you in the long run. So that's the first part, treating the causes. Again, this is a comprehensive approach. I haven't even talked yet about killing the cancer. Next is treating the person. So we get rid of the cause of the cancer. While that's going on, we're now strengthening the person, building up his vitality, building up his strength, building up his immune system. How do we do that? Well, we do that with nutritional optimization, which means we give the nutrition that's optimal to that particular person's genetics. Now, there's a very cool test out. You can learn about this test if you go to spectracell.com. That's spectracell.com. It's called a functional intracellular analysis. This test is really remarkable. It's a simple blood test. It's inexpensive. And what it will do is, in a laboratory setting, the test will determine if your immune system will work any better if you add certain nutrients to your diet. For example, I can get the test back and it'll say, this patient needs extra zinc, this patient needs extra biotin. That's all. Everything else is okay. But if you give them extra zinc and extra biotin, their immune systems will work better. This is a marvelous way to determine what needs to be done, if anything needs to be done, to get a person's nutritional balance up to optimum. The second thing is we use intravenous nutritional support. Many of our patients that come to see us are just completely sick and debilitated, and it's just not enough. They're so empty of nutrition. They're so depleted. It's just not enough to give them good food. It's just not enough to give them some vitamins. You have to actually give them vitamins intravenously, especially amino acids and proteins intravenously. And so we can do that for a while to perk them up and start bringing their status up. Immune system enhancement. There are a number of herbs, and there's a number of homeopathic treatments that are extremely good to bring up immune system. We do measure the immune system status of all our patients. This is something that's probably never done by any oncologist out there ever, actually measuring the immune system. And I guess it's good that they don't, because if they did measure the immune system, they'd find out that none of their patients have an operative immune system. And then they'd have to scratch their heads and say, well, what am I going to do about it? But there are lots of things you can do about it. There are specifically some excellent herbal extracts, some mushroom extracts that can be very effective in activating the immune system. And once again, one of the favorite ways that I have to activate the immune system is to use a specialized form of ozone therapy that is known to do this. So we're treating the person, we're getting the person stronger, we're getting the person's body to a point where it can actually start healing. It can actually start taking control of this cancerous situation. And then the last is hormonal replacement. You know, most cancers do not happen in the young. Most cancers happen in the older. It seems like the older you get and the lower your hormones go, the greater the incidence of cancer. So it's very clear to me that hormonal deficiencies play a significant role in why the patient got the cancer in the first place. But it's also very obvious to me that the major difference between the health and vitality of a 30-year-old and the health and vitality of an otherwise healthy 65-year-old is hormones. 30-year-old is loaded with hormones. The 65-year-old, unless he's replacing his sagging hormones, is just going to be depleted. And in that depleted state, again, it's not good enough. It's much easier for a 30-year-old with all those high levels of hormones to get over a disease than it is a 65-year-old. In fact, due to the high hormones in the 30-year-old, he's probably not even going to get a disease. So hormones are a particular part. So these are the kinds of things we do to treat the person. And now, lastly, we get into the area that traditional medicine gets into, and that is, well, what are you going to do to kill the cancer? So we do have to treat the cancer. So here's how we do it. We'll spend some more time on this part. First of all, we do chemosensitivity testing. We do use chemo drugs, folks. Yes, we do. I'm going to show you how we use them. We use them in a much safer, much gentler way, a way that does not poison the body. But we use them nonetheless. So what do you do when you go in and your oncologist tells you, well, you know you have such and such a cancer, and here's what I'm going to treat you with. How did he determine what to treat you with? Actually, he guessed. He gave you an educated guess. He knows the literature. He knows what the studies show, but he guessed. Does he always guess right? Nope. Sometimes he guesses wrong. Let me tell you a little bit about cancers. Anybody that has a cancer that's getting treatment, I'll tell you this right now up front. Your cancer has never been treated on the face of the planet before. That cancer is entirely unique to all medicine. Nobody has ever seen your cancer before. It's unique. So if you ask the doctor, how lucky have you been, or how fortunate have you been, or what's the kind of success record do you have with my cancer, the doctor can't say that. Can't answer that question because he's never treated your cancer before. He's treated similar cell types of your cancer before, but he's never treated your cancer before. Your cancer is a genetic mutation of your own genetics. Your own genetics are entirely unique. They've never been seen on the planet before. Therefore, your cancer is entirely unique genetically. It's never been seen on the cancer before. Here's the gist of the story. If I have 10 people with, say, small cell lung cancer, each one of those cancers is genetically different. If I treat all 10 people with the same drug regimen, it'll work on some and it won't work on others. And it'll work a little bit on maybe the ones in the middle. So I have to have a way that's better than guessing. Turns out there is a way. Unfortunately, it's not FDA approved, so oncologists can't really use it. But it can be used, and we do it here in the clinic all the time. And it's called chemosensitivity testing. We use a laboratory in Greece. You can get to it by going, you can learn about this test by going to www.rgcc-genlab, that's GENLAB.com. I think I'm going to give you this website again a little bit later. But you can learn about chemosensitivity testing. What we do is we draw blood from any patient with stage 3 or stage 4 cancer. In that blood specimen is metastasized cancer cells. They're actually in your blood. This laboratory can filter out those cells and start growing your particular cancer on culture dishes. And then on each culture dish, they'll put different drugs, and they'll see which one will kill it. I'll get a graph printout that'll say, you know what, if you give this patient drug A, 80% of the cancer is killed in 5 days. If you give them drug B, 5% of the cancer is killed in 5 days. Both of those drugs are indicated for that particular cancer. Which one do you think I'm going to give? Now, without that information, I'd have to be just like an oncologist. I'd have to flat out guess at what could work. I'm not saying that chemosensitivity testing is perfect, that it always hits a home run. But I am saying it is better than guessing, and it's available today, and it's easy to do. So one of the things we do in treating the cancer is we do depend on getting a little bit of a head start on what chemotherapeutic agent is best for your cancer. Incidentally, this particular lab not only tests chemotherapy agents against your cancer, it also tests natural agents like vitamin C. You know, you may not know this, but the National Institute of Health has discovered that vitamin C actually does kill cancer when given in an appropriately high enough dose. That has to be done intravenously, folks. Don't try this at home. But vitamin C will kill cancer, so will hydrogen peroxide, so will the bioflavonoid quercetin, and a lot of things. In certain cancers, they'll kill them. And this lab also tests for those natural substances. Okay, so that's the testing part. Then we do what's called IPT, or insulin potentiation therapy, and I'm going to talk about that. I spent a lot of time talking about that, so we'll just skip that for right now. That's the part that literally kills the cancer. Okay? But I want to mention these last two things, and then we'll get in more into discussion about the IPT. The third one is anti-angiogenesis therapy. When we get the chemotherapy test back, it will tell us if that particular tumor is very dependent on angiogenesis. Angiogenesis is the ability for the tumor to cause blood vessels to grow towards it so it can expand and grow faster. And tumors that have that ability can be treated very successfully with agents that block angiogenesis. And so there are good drug agents. There are also good natural agents that block angiogenesis. So in those tumors that are susceptible to that, these can be invaluable part of killing the cancer. And lastly, there are special herbs and special nutrients which we have found can kill some cancers or can at least weaken them. So special herbs and special nutrients that in each particular cancer can be added into the program to increase the opportunity for the other therapies that we're using to kill the cancer. So that gives you a brief overview now of a comprehensive cancer approach. We're treating the cause. Simultaneously to that, we're treating the person, getting them strong. Simultaneously to that, we're killing the cancer. Now let's talk more about IPT and how we actually go about the killing the cancer part. The problem with conventional chemotherapy is the dose. Chemotherapy kills cancer cells. That's what's so appealing about it. That's why people go in to see their oncologist and they get shot up with chemotherapy agents, because they know, in all likelihood, it's going to kill the cancer cell. And that's what they want. Patients are so scared they've got the cancer, they forget that you can have cancer and it not be a problem at all if your immune system and everything's intact. All they think about is, I got to kill the cancer, got to kill the cancer, got to kill the cancer. I don't care if it kills me, I don't care if it kills my immune system, I don't care what the heck it does, I've got to kill the cancer, got to kill the cancer. That's all they focus on. And so they're very, the idea of a poison in your system that's going to kill this cancer is an appealing kind of idea. The problem is the dose. Now here's the deal. In order, you're a big old person. Say I'm 175 pounds. So I've got a 175-pound guy here. Let's say I've got a half-pound tumor in me. That's a pretty big tumor. Say I've got a half-pound tumor. I'm going to have to, if you shoot chemotherapy drug in me, that drug is going to get dispersed throughout all the cells. It's not going straight to cancer. That drug is going to get dispersed to all the cells. So the majority, you got a 175-pound guy, half-pound tumor. So that's 1/350th of that drug is going to get into the tumor. The rest of it's going to the rest of me. And it's poisoning me and making me sick. And only 1/350th of that dose is getting to the tumor. So in order to get a decent enough dose in that tumor, I've got to give a pretty stiff dose of chemotherapy, which means I'm going to get poisoned. What if it were possible to, instead of the drug being equally diffused out in all cells, to focus it more, target it more to the chemotherapy, to the cancer cell? Then you could give less. You could give less of a dose. You could give a dose so small that it would not be very poisonous, if poisonous at all, to the rest of the body, and would spare the rest of the body. And that's in essence what we do with insulin potentiation therapy. And I'm going to be explaining to you how that works in a second here. But that is the issue, dose. So if you can use a lower dose and still get the same amount in the cancer cell, that's the ticket. That allows the patient to kill the cancer and at the same time not poison his own control systems. You need to know that cancers can only live on glucose. They can only live on sugar. All of our cells all healthy cells can live on fat. You can take the sugar out of the equation, and except for your brain cells, by the way, except for your brain cells, all your healthy cells can live on fat. You don't have to have any sugar for them. You know, if it would be possible, if the brain could live on fat, it'd be really easy to cure cancer. All we'd have to do is just take the blood sugar down to 0, leave it there for about 5 minutes, and every cancer cell in your body would be dead. It can't survive without sugar, but all your healthy cells can. Except we can't do that because as we lower the blood sugar, eventually your brain starts getting deprived in sugar, and we get too low, you're going to kill your brain off. So we can't do that. But it's an interesting thing to know that cancer cells are mutant cells. They're abnormal. They cannot survive on fat. They have to have an abundance of sugar. Now I'm telling you that because you're going to see in a minute how we can use that to get more chemotherapy agent into the cancer cell. The other thing that IPT does is it's going to induce more vulnerable cells per treatment. Now, we're going to talk about this in a sec, and I'm going to show you some slides on this. But cancer cells go through a growth cycle, just like all cells. And in that growth cycle, there's parts in the growth cycle where they're susceptible to chemotherapy, and there's parts of the growth cycle where they aren't. They're kind of innate and dormant. And only during those parts of the cycle where they're susceptible to chemotherapy will the chemotherapy work. It turns out that insulin, the hormone insulin, causes a greater number of those cells, almost double the amount of those cells, to be in that vulnerable position. So insulin exploits the sugar idea, and insulin also induces more vulnerable cells to be killed per treatment. So it really does assist. So IPT is a way to get 10 times more chemo into the cancer cells than gets into healthy cells, and at the same time to have almost twice as many of those cancer cells vulnerable or susceptible to the effects of the chemo. So this probably is a little confusing for you, so we're going to break this down right now, and you're going to understand a little bit better. Here's what you do with IPT. Patient comes in, they're fasting, so their blood sugar is usually around 90 or 100, right in that. We infuse the hormone insulin intravenously into that patient. Insulin causes a rapid uptake of all the sugar in your blood cell by all the cells in your body, including your cancer cells. So all the cells in your body suck up the sugar in your blood. All the cancer cells suck up the sugar in your blood. And your blood sugar starts going down. And we give a lot of insulin. So we give enough to bring your blood sugar all the way down to about 30 to 35. It's right around at that point that your brain starts to feel the effects of not having enough sugar. So that's how we know when we're right at the edge. The patient will start saying, you know, I feel a little fuzzy. My vision maybe is a little blurry. Maybe I feel a little nauseated. I feel a little dizzy. Patients often feel warmth or flushed. So we know, and of course we're measuring their sugar the whole time, and we know, and we can very safely and easily get them down to a blood sugar of about 30. Now, here's what's happening. We're going to leave them like that for about 5 minutes. Here's what's happening. When the blood sugar is 30, all your healthy cells are doing just fine. They don't have a problem. They can burn fat, it's not a big deal. Your cancer cells, your brain cells are doing okay too, because they're getting enough to go by. But your cancer cells are in deep trouble. Your cancer cells need a lot more sugar than your brain cells do. So to get that blood sugar down is really hurting them. They're going crazy. For a cancer cell to have a blood sugar of 13 is kind of like you and me breathing, but we're breathing through a straw. We're getting enough to maybe keep us alive for a little bit, but we can't keep that indefinitely. We're just going to wear out. That's what's happening to that cancer cell now when that blood sugar is down around 30. Not only that, but since we've introduced sugar initially into the cancer cell, more of those cells have gone into what we call the S phase, or that growing phase of the cell that is vulnerable to cancer. So here's the situation. We've got more cancer, as a result of putting this insulin in, we have more cancers that are in the S phase, more cancers that are vulnerable to chemo, and all of the cancer cells are depleted of sugar, so much so that they are opening the floodgates of all their cell membranes to get any sugar they can possibly get in. And that's the status of the situation. At that point, we inject chemotherapy drugs. We use our chemotherapy testing, the chemo drug testing, to know which drugs to put in, but we inject the drugs. But we only put in about 1/10 of the normal dose. Why? Because those cancer cells are going to suck up 10 times more of it than they would have had we not gone through this procedure. So we're going to put in the chemotherapy drug, and then we're going to flood the patient's blood with sugar. Now what's going to happen then is that sugar gets dramatically taken in by the cancer cells. Along with them, they also pull in the chemotherapeutic drug, and we get a higher concentration of that drug in the cancer cell, and at the same time, more of those cells are vulnerable to chemotherapy agent, and that's how this works. That's how we can get away with using such a low dose and still get the same kill effect that we would get if we use the high dose. So, the advantages of insulin potentiation therapy: it selectively targets cancer cells. We get higher concentrations of the drug in the cancer cells, not equal concentrations like you do with conventional chemotherapy. It targets those cells. Secondly, it enhances the anti-cancer drug effects because the cells are depleted, they're weakened. Again, if you make me breathe through a straw for 5 minutes and then challenge me, I'm not going to do very well. I'm already in a weak and debilitated state. The same with these cancers. When that drug gets into them, they're already in a deplorably weakened state. We use very low doses of chemotherapeutic agents, which means that it's entirely safe to your healthy cells. We rarely see any side effects with our patients. And so it almost completely eliminates the dose-related side effects. Many of my colleagues who use these treatments, and by the way, there are physicians all over the world that use IPT. I'm certainly not the only one. You can find a physician in your area if you just go to iptforcancer.com, iptforcancer.com. So there's doctors all over the world that use this technique, and all of us will tell you that yes, we do see some side effects, but by and large, mostly we don't see any side effects, and when we do see side effects, they're very mild, and we often refer to this as the gentle form of chemotherapy. So those are the advantages of IPT. Let's talk a little bit about some of the science around that. I told you that cancers need insulin. Cancers need sugar. I told you cancers need sugar. Well, in order to get that sugar, they need insulin. So cancers are really interesting. They make their own insulin. They need it so much, they make their own. That gives you an idea how much they need it. For example, this is normal breast tissue, and this graph shows you how many insulin receptors are on normal breast tissue. That amount. Look what happens when you have breast cancer. The insulin receptors go up dramatically, 4 to 10 times more insulin receptors in a cancerous cell, breast tissue cell. And over here is a benign breast tissue cell, benign, what we call a fibroadenoma. It's a tumor, but it's a benign tumor. You can see that benign tumor, normal breast tissue, about the same in terms of insulin cells, but there's a huge difference with the breast cancer tissue. Again, this is just a dramatic way to graphically show you how dependent cancer cells are on sugar and why this insulin potentiating therapy works. This insulin effect, by the way, is proven. That's why so many of us doctors use it. So that they have done studies at the George Washington University National Cancer Institute and also at MD Anderson Hospital and Tumor Institute. And they have tested and proven that insulin does, in fact, potentiate the effects of chemotherapy. And here's what they do. In a test tube, they take cancer cells that are in culture and they add insulin to them. What they find out is that the amount of cells that are in the S phase is increased to 66% compared to 37% of those who are in the S phase without the insulin. What I'm telling you is when they put that insulin in the test tube, all those cancers will, a great majority of those cancer cells go into an S phase. They love the insulin so much that it turns the cancers on and they start growing like crazy and they get into that S phase. And that's where they're vulnerable to chemotherapy. So by adding insulin, what we know is you're going to take 37% of the cells that are in an S phase and jump that all the way up to 67% of cells in an S phase. And then you're going to hit them with chemo, and that's why insulin potentiation therapy can work so well, because a greater majority of these cells are in that vulnerable S phase, and the chemo can kill them better in that S phase. This just shows kind of how the S phase works. Here's a cancer cell cycle. It has 2 rest periods. This is where it synthesizes its DNA, and this is where it divides and multiplies. This is a normal cell cycle. This is a cell cycle that happens once you've added insulin into the cancer cell. You can see that the rest phases are much lower, but the mitosis and the DNA synthesis, these S phases, are much larger, and this is where the cancer is vulnerable. So this is without insulin, that's the vulnerability you have. This is with insulin, that's the vulnerability you have. Rather dramatic shift in the vulnerability of cancer cells to be affected by the chemotherapy agents. Okay, so in conclusion, a comprehensive approach to cancer includes 3 aspects. Yes, we treat the cancer, we do something to kill the cancer, but just doing that isn't adequate. You've got to treat the cause. This is true for any disease. You can't expect to get over a disease if you don't eliminate what's causing it. What causes cancer is decreased oxidation. This comes from a sedentary lifestyle, from excessive stress, from bad eating habits, from hormonal deficiencies, from all kinds of reasons. But those things lead up to decreased oxidation, liver dysfunction, again, bad diet, bad lifestyle habits, lead to toxicity from the environment, lead to this, and overall toxicity and stress. You have to treat the causes. Eliminate the stress, improve the oxidation, clean out the liver, detoxify the patient, and you've gotten rid of what caused the cancer in the first place. Secondly, you have to treat the person. That person has to be the strongest, healthiest person on their block if they're going to get over something as serious as stage 3 and stage 4 cancer. So to do that, we use nutritional optimization, we use intravenous support, immune enhancement, we use massage therapy. Massage therapy is important. It relaxes the patient, de-stresses them, and really helps to mobilize a lot of the toxins that are located in the soft tissues, connective tissues, and hormonal replacement. These are all the kinds of things that will get that person strong again. And lastly, yes, you got to do something to kill the cancer. And to do that, we use chemosensitivity testing to know for sure what's most likely to work in that patient. We use IPT, a gentle approach to the use of chemotherapy, that allows us to target those cancer cells in a way that leaves the healthy cells without accumulating all the toxicity that you can expect from the conventional approach. We use anti-angiogenesis therapy and special herbs and nutrients. You put that whole package together, you can dramatically improve your odds on having a long-term remission of any kind of stage 3 or stage 4 cancer. To just use the simple-minded, one-dimensional, hit it hard with massive dose of chemotherapy and radiation approach that has been proven not to work is just not a good idea. What can I say? One last note, and on that vein. If you are thinking about using a comprehensive approach to treat your cancer, do that first. Don't make the mistake that so many other people that we've seen have made by saying, you know what, it's a lot easier for me to go see my conventional oncologist. I mean, he's not going to tell me I got to do this diet. He's not going to tell me I have to take these vitamins. He's not going to tell me I have to change the way I live. He's not going to give me all kinds of detoxifying therapies to do. He's not going to do any of that kind of stuff. He's just going to give me the chemo. He's going to kill cancer. And I'll go do that. And if and when that doesn't work, which, folks, you just saw the statistics. You know how often it works. If and when that doesn't work, then I'll do the alternative approach. What I'm here to tell you is by the time you come in to see me, having done that, there's pretty much no way any kind of approach will work with you. You've already been poisoned to the point that, in my opinion, you've been poisoned to the point that it's no longer possible. Your body cannot recover from that level of toxicity. Figure it out. By the time you even start your first conventional chemotherapy treatment, you're already weakened and debilitated. So you're going to take somebody like that and slam them more? If you took a world-class athlete and gave him conventional chemotherapy, he'd be debilitated. What are you going to do when you take somebody who's not and you give them that? It gets worse. There's very little hope for anybody if they've done the conventional chemo first. So I strongly suggest to you that you do a comprehensive cancer, make that your first goal. Okay, and just one parting note to you all, if you have cancer, I do wish that you take all these things into mind and that you do change your life, and I pray that you will recover from that cancer and that you will feel comfortable and enjoy the rest of your life.